Understanding how viral hemorrhagic fevers or VHFs spread is crucial for effective prevention and control. These diseases can cause severe illness and even death, making it essential to know their transmission pathways. These viruses have different modes of transmission, often involving animal or insect vectors. This means that the viruses can be carried and spread by animals or insects, which then infect humans. Ebola and Marburg, for example, are zoonotic diseases, meaning they originate in animals and can be transmitted to humans. This zoonotic nature makes it challenging to control outbreaks. Bats are considered the natural reservoir for both viruses. They harbor the virus without getting sick, acting as a source of infection for other animals and humans. Transmission to humans typically occurs through direct contact with infected animals or their bodily fluids such as blood, saliva, or urine. This can happen during hunting, butchering, or handling of wildlife. Dengue, on the other hand, is primarily spread through the bite of infected Aedes mosquitoes. These mosquitoes thrive in tropical and subtropical regions, making dengue a significant public health concern in these areas. Lassa fever is primarily transmitted through contact with infected rodents or their droppings. These rodents often live in and around human homes, increasing the risk of transmission. Crimean Congo hemorrhagic fever is spread by ticks, primarily of the Hyaloma genus. These ticks can attach to both animals and humans, facilitating the spread of the virus. The virus can also be transmitted through contact with infected animal blood or tissues. This is a risk for people who work with animals, such as farmers, butchers, and veterinarians. Once a human is infected, these viruses can spread from person to person through contact with bodily fluids. This includes during caregiving, medical procedures, or even traditional burial practices. This includes blood, vomit, saliva, and other secretions. Contaminated materials such as bedding and medical equipment can also be sources of infection. Proper hygiene, personal protective equipment, and safe burial practices are crucial for preventing the spread of VHFs. These measures help protect healthcare workers and the community at large from these deadly viruses.